Hello, I am Dr. Narotam Dewan, Master of Surgery, and I am a surgeon of about 40 years standing. And, I suffered from coronavirus. It's a pandemic happening throughout the world. People are suffering, falling ill, and people are dying. So it feels nice to be back to work. And but I want to share my experiences so that they can be of benefit to the public at large, the doctors, and those who fall victim to this disease. And the first topic over here I'm taking is that the involvement and element of fear and panic in this disease. This is obvious. The statistics which every learned person, educated person, and the otherwise person who is not educated is listening or going through is they are horrifying. The people say about 3 lakh people about to die in United States of America, in Germany, in England, in Italy, anywhere. So the huge, very big number of mortalities, registered and known mortalities. You must know that there are unknown mortalities in many countries where the reason is not assigned. A person dies without investigation of RT-PCR or some other test due to coronavirus, but maybe assigned to some other disease. So this is a real thing. And so first fear that came to my mind and will come to any person's mind was whether he or she is suffering from coronavirus. When the symptoms they come and they stay and they increase and they don't go by normal measures, the first fear is a good fear that okay, I may be suffering from COVID-19 or coronavirus disease. And you see, this fear will take you towards quarantine, self quarantine, isolation, and towards investigation that, okay, let me investigate whether I'm really suffering from this dreaded disease. And that's what happened with me. And I'll come to it in the next talk of signs and symptoms. But this symptoms increasing gradually and not going away, that led me to get my laryngo, nasopharyngeal test of coronavirus swab done, RT-PCR, and then I isolated myself. That was a good fear that I should not spread it. I stopped practice and went into a room, told my family, well, I am now, don't come into this room, and I am here, you are outside, just keep giving me water and food and whatever. So that's what, and the next day it came positive. So now the second fear is the real fear, and that is that how much disease do I have now, what will happen, where should I get treatment, what will be the treatment? Will I become all right or not? So, what? Don't panic here. There can be panic at this stage. First, you are not sure you are having coronavirus. Second is you are having coronavirus now, and you are having some symptoms and some problems, facing some problem. Now you are fearing that how much disease I have and where to get treatment, what will be the expenses, what will be the outcome. So these fears and panics must be controlled, and with the sane mind and advice of your nears and dears, your family members, the doctors, your family doctors is very important, and they will tell you how much at risk you are. Means somebody who doesn't have an asthma problem, lungs problem, who is a non-smoker or a smoker having a pulmonary obstructive disease or not, like smokers have some problems, damage to their lungs, or the people working in some places where the fumes or dust that causes some panic, some damage to their lungs. Panic comes like that. Okay, so this things, person is diabetic or not, and diabetes is controlled or not, person is having a heart problem or not, and that is controlled or not, person is obese or not. So any additional diseases will increase the risk. So one has to consult, and then one has to do the investigations about the extent of the disease. Now, depending upon the age, upon the severity of the symptoms, one has to decide. And this, the here in India, the government also helps. They come from the department and they advise you. Like I got admitted myself into a nursing home, the owner of whom I knew, and they started treatment and started investigations. Very important investigations to know how much inflammation is taking place. Basically, this causes inflammation in your body. Now, this inflammation can cause coagulation of your blood or cause pneumonia of the lungs. They can get inflamed and swollen like wet lungs, and the air entry to the lungs will be restricted. So, person will not be able to take in oxygen and bring out carbon dioxide. So that inflammation or the blood will clot, or there can be a other problems like a stress reaction, which is a can cause disseminated again coagulation and pneumonitis and inflammation. So tests like D dimer, like ferritin, like IL-16, uh, PCR test, all these tests, they indicate about the severity of inflammation going on in your body and the likelihood of blood getting clotted. And second thing is how much the lungs are affected. So chest X-ray or a CT scan better if you have. So that's very important. That will tell you how much disease you have. Like in my case, it was a mild disease, but I am a senior citizen, so that increases. Although I didn't have any diabetes, mellitus, hypertension, cardiac disease, lung disease, obesity, any other problem, comorbidities, but I am a senior citizen and I was having significant symptoms, although the CT scan showed that the lungs are not that much affected. By I had to be put under treatment. So now the question is, you get admitted, then you have to be watchful, and something like that. When you will see go into a ward, there you will be isolated, quarantine. You will not be, your relatives and friends will not come and meet you. They will just call you on your mobile, and you will see many patients coughing, some people on ventilator, some people dying. So then it will again be a cause of fear and panic. But you have to keep your minds and nerves strong, that everybody is not dying of COVID. Some people who have severe disease and who are not able to respond back, they get severe disease and they may die. They may have lot of more complications, but you may not have all these complications. You keep in mind the brighter side, that for you there will be a light at the end of the tunnel, and into this dark prison like place where you are quarantined and you are all alone, and there are some nursing staff who is overworked, and who may not be that much qualified because of shortage of nurses, nursing staff, and the doctors who are busy, and some who are afraid of coming too frequently to the COVID and corona wards may not be visiting you that regularly. And you are out of your comfort zone into a new place where there will be many problems. You do not have your comfortable things with you, like your beddings, your pillow, your blankets, your clothes, your toiletry items, and you are at a different place which may be of not your liking and standard. And so these things will increase your fears and panics, and you're the risk of cross infection from the hospital, other patients, which is always real there. But don't lose your nerves and keep your treatment. Like this treatment, the steam inhalation is very important, the coagulation anticoagulants, because and corticosteroids when to give. Then you are thinking whether I am being given right treatment. For very important to be asking your doctor what treatment you are giving, and to remain in consultation with your family doctor or the other doctors which you know, and your family friends, that you are being treated adequately, in time and properly. So these fears, but as the disease will either improve or it will prolong, or in between due to the effects of medicines, like they may give anticholinergic, some things medicines will call you as sleeping. The disease itself will call you. They will give you cough syrup that will also induce sleep, and the senses will become dull due to this sedation caused by cough syrup and other medicines. So that time, when you are into 2 3 days into the disease, and if you are admitted, then really there can be increase, and you are isolated. You may not be getting the proper food or proper care as you so wish, and proper routine you are not able to follow. So then there can be panic, and you have to then depend upon number one is your determination that, okay, I will make it. I will make it. That's what I did. And number two, on prayers. Whatever you believe in, whether you believe in yourself, then determination. Believe in God, whatever religion you know, whichever values you know, that okay, if God wants me to serve the people or has some purpose for me, it will depend upon the wish of God. Let me remain peaceful. Then meditation means don't think of the past and the future, just meditate on your breathing. It's the easiest way to meditate, is to meditate on breathing. This is what I did. Is also have additional benefit. When you took deep breathing and you release it after keeping in some time or sometime, this not only bring your thinking fears, take away your fears of future and past, your relationships and what will happen to your relatives, what will happen, what may not happen, your fears and anxieties. This will bring back to that you are alive, you are breathing, you are fit. And this meditation and deep breathing exercise will help you in your lungs also. So this thing in remain to avoid fears and panic. Very important for the relative and friends to call you on mobile. Everybody, most of people have mobile. If somebody doesn't have, I will tell that please give the person mobile. Even if it's a child or a very old person or a poor person, even the hospitals should provide mobiles to the people so that they can remain. If somebody doesn't have smartphone, they can supply smartphone to the person, and after sterilizing it, so they can remain on video calls on seeing the other persons. And tell you another thing: if you are a patient, you are seeing my video or you will see my video, or God forbid you fall victim to this disease or such other disease, if the people are not calling you, call them. I said, did some people called me, some didn't call. So I called them. When I called them, they start calling me again and again. Because everybody is busy and some people are maybe afraid that coronavirus will travel through. A voice can travel through and picture can travel through and video can travel through the smart mobile. Maybe coronavirus will also travel. This is not true. This is just a joke. But they have to sport. Very, very important to remain in conversation and by the other people, friends and relatives and the sporting staff. And very important to that I think some staff of the, I will now talking as a doctor, as a surgeon, having worked throughout the world, I request all the nursing paramedical staff to these patients, coronavirus patients, they require special support. Please provide them with the special, just sweet talking, you're reassuring them that most of the 96 7% of the patients, which is a very good outcome, are getting all right and going home well. And really, like I suffered on the fourth or fifth day night, when I was having extreme fatigue. Cough had become all right, fever had become all right. There was no expectation, but headache had become less. But extreme fatigue overpowered me, and there was medicines which were causing me sleepiness, and I was falling in my bed like that. I felt, and I, just laid down, and I said, "Okay, let it be. The world is without beginning and without end, and we all change shapes and forms here. Nothing is born and nothing dies. Everything that borns has to die at some stage, but it doesn't die, it changes that form. And maybe soul is immortal or not immortal, but energy is immortal, and matter and energy will exist as God wishes. So I laid down. So that time I didn't, reply to the WhatsApp messages of my old friends who lived with me, worked with me outside the country in Libya. They are all types in all the countries, and they are all religions. Dr. Samuel and Mrs. Samuel. They are now having their retired life working in church. Dr. Gija Krishna and Srinivasan Krishna. They are also doing most of the charitable work and some professional work. And Dr. Rajan Duda from Malaysia is a pediatrician. So they, Dr. Samuel wrote, which I read later, what's happening? What's happening in the group? And they called me. Dr. Krishna called me, you fight back. They called me in a very good voice, fight back, fight back. We are, leave the prayers to us. So they were praying in the temple, in the church, right? So I also fought back because they encouraged me. They saw that I am going, take two different difficult circumstances head on, like catch the horn, bull by the horn. So I took up my, because I like to see these historical movies and World War and Roman Empire and Mongolia and all these things, So I took up my swords and I thought that I'm fighting the coronavirus and I will win. So very important to become determined and to fight it. It made a difference. I was cutting coronavirus left and right and left and right and then beheaded the coronavirus. And I got up and changed, started moving my hands and feet and limbs, taking deep breaths. So don't let panic and fear overpower you and your patients and your relatives and friends. Support them and support yourself. You have a lot of powers and energies inside because nothing happens without the will of God or destiny, because this all, even if you are atheist, you don't believe in God, this all is a physico-chemical process of the universe in energy, matter, space, and the process. So these chemical and physical processes are from trillions and trillions of years. They are predetermined. I have to live for how much time now? I have to deliver this speech to you. So enjoy. If you learn something, press the like button, subscribe to my channel, and share it. I will be giving my experiences under different heading. This was under fear and panic. So this is very difficult. This is walking through fire and crossing a, swimming through a sea or canal where there are crocodiles. But don't panic. Keep going. Then you will come out. If you stop, then it will be a problem. So bye bye for now. I will bring the next topic on my own personal experience having through the coronavirus and through it. Bye bye for now. We shall meet again.